Hello, you're awake. No, don't be startled. Actually, can you just... No screaming, it's okay. I'm not some sort of an illusion. I'm not someone pretending to be me. I really am the princess. I know, it's confusing. Okay, See, I got bored of being in the castle all the time, and they just won't let me out, so I snuck out, and I've been so interested in the medical field and specifically your region because, you know, you get to go to Earth. How exciting. I did my hair kind of human-ish today. They don't have sparkles. What do you mean? Oh, well, see, I can learn a lot from you, if you let me. Okay, so here's the thing, okay? I know that you've been briefed a certain set of events that are going to take place today, okay? Could you show me the briefing? Yeah? Thanks so much. This is quite an old piece of paper. Okay, so... Oh, you just returned. So that is not very long ago. How come there are no doctors seeing you? They're all sick. I guess that explains why I could come in so easily. Well, anyhow, would it be okay if I performed these things on you? It's nothing painful, I promise. It's, I mean, we will be renewing the mask on your face to make it look a little bit, you know, different. Yeah, since your time on Earth is up as a human. Yeah, we want to just change that around a little bit. Maybe change the shading, the texture. Yeah, you will be going back to Earth as somebody aged 25, living in a place called... I can't quite make that out. What does it say? California. Okay. Well, I've never been, so that should be interesting. Did you have any preferences written down or anything? No. Okay. Well, we'll just look at the examples that are up here on the screens. We'll look at those and then just kind of go step by step, I'd say. What do you think? Great. Okay. So, let me get acquainted with all the bits and pieces. I applied the gloves as I came in, obviously. I don't want to contaminate you with anything. I mean, you've been gone for 100 years. Yes. Let's see. I'd say first we prepare your skin a little bit. Have they done a skin sensitivity test with you so far? No. Okay. Well, if you don't mind me, I'm just going to get a tiny bit closer. I'm just going to tap along the skin and see if I can see any changes. Going by my book research. So my first client as is. I've always wanted to go into the medical field, but obviously my profession was kind of laid out for me. But, well, maybe we can start a little change around here. Okay, don't you worry, I'm going to make sure that you're completely fine. You're in good hands, okay? Okay, so if I prod here, is that okay? No pain? Okay, this side? Okay, right, and for the front part, just check the ribs. Okay, and the other set of ribs. Okay, and all your forearms are working, yes? Okay, perfect. How do you disguise them on Earth? Or you just make them invisible? How smart. Very, very nice. Makes a lot of sense. Now, let me use a soft object here, okay, and a sharp object, okay. If you would just close your eyes and tell me what you can feel. Yeah. I'm just going to either dot like this or dot like this. Could you tell the difference already? Okay, good. Right, so close your eyes, just keep them closed. I'm just going to dot. Sharp, very good. Sharp. Soft. Sharp. Soft. Soft. Sharp, very good. Let's move up a bit. Sharp. Soft. Soft. Sharp. Soft. Soft. Sharp. And soft. Very good. Okay. Any discomfort in your skin at all? Okay. I ask because obviously you are exposed to pretty close sunlight in comparison to how we usually walk around. So, oh, you've been using a specific lotion for that. Well, that's just perfect. Okay. Do you have that with you by chance? Oh, I see. Okay. Very high SPF. Well, that's good. Very important. And now, have they scanned you regarding new data? The one that you should be receiving? Oh, so they've only scanned you to give data. Okay, interesting. So in that case, I think I'm just going to dot your face, okay, in the corresponding regions so that we can move along the little device so it can cover your face like so and then scan off the information that is hidden beneath. Yeah? Okay. Behind your eyes as well as of course in the brain. Okay. So we're just going to dot right here, right there, and here, here, and here. Okay. Let's see if that's not going to rub off or anything. I don't think we need any other of the dots, so that's perfect. I'm just going to move the scanner up here for you, just like so. Just going to scan the information. You shouldn't feel any pain at all. Good. Excellent. Almost done. Okay, very good. Now let's see what we can do here. Just to connect this to the computer here. Okay, right. Okay. So 100% of the information should have been now stored right up here. Do you feel any different? Okay, good. So you've acquired knowledge regarding what exactly? the new happenings, new plans. Good. Okay. The most recent memes? Is this for Earth? I see. Okay. Right. Okay. Well, that's perfect. So, in that case, we can just quickly remove the dots on your forehead here by just taking some of the gel here and just wiping them off your face. Okay, good. So we go on to the next step. Right, so it says on here that we would need to give you a bit of an ear clean and also clean your face. Okay, just to make sure that you are fresh and ready for the new journey. So let me just, let's start with your face. I always think it's nice to have a fresh face. Okay, and now adding the cleanser. Move around the product a little bit and then gently wipe over your face like so. Nice and fresh. It smells good, doesn't it? I agree. It's rather wonderful. Now, if you could just extend your ears just a little bit. All four of them. Okay, perfect. So we're just going to connect the pipes in here. And they should give you a very gentle and warm rinse and also remove any buildup. Just apply these here and here. Make sure that everything is placed the correct way. Okay, very good. And now we can activate the cleansing stream. There. Should feel it in one ear first, then the next, and the next, and the next. Meanwhile, I'm going to take this. remove the tubes again. Very carefully. Seems to have been a great success. Lovely. How do your ears feel? Yeah? Should we do a little hearing test? Okay, close your eyes. I'm going to be making sounds with my hands, like so. Sometimes some fluttering sounds. Now, in which ear does the sound stop? Your right ear. Good. And again. Your left. Very good. Okay. Let's just prod around the ears. Perfect. Okay. Now, if we tap on, do you hear this in your right ear? How about now? Left. Right. Left. Very good. Okay. And do you hear the sounds coming closer? Further away. Very good. Close. Further away. Excellent. Okay, that's looking wonderful. Now let me see what the next step was. Okay, it says here we have to use new face sheets, apply them to your face, and then sculpt them somehow. I'm sure it'll make sense. They are in here. Now, I mean, I suppose these are quite stretchy in a way, especially this way around. I don't know how we're supposed to sculpt with them, but I'm sure it'll make sense. Okay, so I suppose we apply the first one right here. And it's supposed to stick to the skin. Okay, and on the sides here. Good. This side here. And above your forehead here. So apparently those should somehow change their texture in a moment, and then we can kind of massage them and make sure that they really mold into the shape that we want. Which brings me to the question, if you see those images over there of the different humans, what would you like? I'm not saying I'm an artist by any means, but maybe we can work something out that might look similar. Which one out of these four? Take your time, that's okay. Yes. Okay, yeah. I see. It becomes a lot more bouncy. Interesting. Now I'm just going to be looking over at that corner there just to have a reference here. And just kind of gently sculpt right here so that we have a rough idea of what we're doing here. And after this is done, we can also perform a little eye exam if you'd like. I don't know where you keep your little lights or torches, so we may have to just focus on actual movement right now. But I don't think you should mind. Right? Okay. Just very gently move the structures out of the way and then just smooth it out. Your chin and your nose is going to look especially different. I think your forehead is going to end up looking quite similar. And then for the finer pieces, as in, the lips, the nostrils, or the eye shape, I think I'll let another professional do that, which reminds me, if someone should come in later and ask you who performed this on you, no matter what outcome, would you mind lying for me? I mean, if it ends up being really good, then you could just compliment whoever you think is the best here, And if it's not good, then just, I don't know. Thank you. But I'm sure it'll be great. It's just the, first time working with a client and preparing their face like this. So, I hope that's okay. Really make sure that is as smooth as possible. I'm sure that you will be given an additional layer for the pores that humans have, and the very small irregularities, maybe even some sunspots or freckles, beauty marks, just to make you more human, more unique. Just make sure that you are looking just as you want to. Okay. Let's just smooth out the central area a little bit. And then just blend that out. You look very different. Of course, this is only the base colour that we have. I mean, no human is actually the colour of a piece of white paper, so I think we should maybe apply some paint. But beforehand, can you move your jaw properly now? Okay. Can you open your jaw a little bit more? Okay, perfect. Now what about your teeth? How are your teeth doing? Are they okay? Can you kind of chomp down? Just gently, of course. Yeah? Okay. Right, any pain there? No? Perfect. Okay. as a matter of fact, if you should feel hungry at all, I could ask one of the helpers if they could bring you something. Yeah, okay, good. Now, I've taken my gloves off now because I will not be touching you any longer. So, if you could follow this finger with all your eyes but not move the head. Yeah? Okay, just follow the tip of the finger. Okay. Perfect. Okay. Very good. Wonderful. Okay. Right. Other hand. Just follow the tip of the finger. Follow the tip of the finger. Good. Very good. Okay. Okay. Right. Now if I put both hands up and I move them in like so, I'm going to be testing your peripheral vision by doing this. I'd like you to tell me if you can see both of the fingers popping in or just one of them. 1, 2, good. 1, 2. Okay. 1, 2. And when do they both leave? One is gone, and the other one. Very good. Which one leaves first? Left, right, and again. Right, left. How about now? Both of them. Good. Okay. Now can you look up for me with all of your eyes? Okay. Goodness me. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Okay. Right, and down with all of them as well. Good. Okay. And to your right. Yep. And to your left. And back to the center. Okay, very good. I don't see any discoloration or anything that would be concerning, so I'm thinking that is looking great. Okay, and now just to test a tiny little area where they would colour the rest of your face, I'm just going to try this shade here. Yes, I think the undertones look pretty good, although I think I'm just going to leave that to the experts. Okay, so other than that, it doesn't see anything else on the report there, so I think you're all done for now. Thank you very much for letting me do this. I hope it was okay for you as well. Oh good, yeah. Plus you'll have something fun to think about, you know, on your next travel. The princess was my doctor. Actually, maybe don't tell them. That might be a bad idea. Anyhow, I have some royal duties to take care of, so I have to somehow sneak back in to the palace. Maybe I'll just take a stroll and make sure that more of you have seen me, so I won't be too suspicious. But yes, I'll be on my way, and you can go back to sleep. I'm sorry for bothering you. So, you have a great day, okay? And thank you for everything you do. Okay, I will see you